Hello everyone. How are you? Welcome to the International Conference on the Science and Technology for Sustainability 2020. My name is Hiroyuki Takeda, a member of Science Conference of Japan from University Tokyo. I'm honored to serve as a moderator for the conference today. I look forward to a lively exchange of information and insights. Also, hello, live viewers. Thank you for joining us today. I have some housekeeping announcement first. A simultaneous interpretation in Japanese and English is available. Please select a language from the interpretation function from the toolbar at the bottom of the screen. Also, automated captions, live transcription are also available. Please select live transcript from the toolbar at the bottom of the screen. Then select enabled auto transcription. But please note that this automatic subtitle feature is only available on PC. Also, if you have any questions to speakers, please submit to the Q&A box. Questions are accepted in both Japanese and English. We will select and address them later as much as the time permits. Some of the materials presented on this conference will be posted on the Science Council of Japan website at later. So now, announcement for Japanese audience in Japanese. ライブでご視聴の皆さん、こんにちは。日本語と英語の同時通訳にて配信しています。お好みの方でご視聴いただけます。画面下のツールバー、通訳の機能からお選びください。よろしくお願いします。So now, I'd like to take this opportunity to also thank supports to this conference from the Japanese Association of Social Welfare Academic Science Societies, JASWAS, and also thanks for the International Association of Schools of Social Work, IASSW. So first, let me quickly introduce everyone on this screen. So Professor KAJITA Takaaki, the President of Science Council of Japan, Distinguished University Professor at the University of Tokyo. And Professor Sho Rajiv, Professor at the Graduate School of Media and Governance, Keio University. Professor Kuni Osamu, CEO and Executive Director, Global Health Innovative Technology Fund, GHIT. And Professor Goto Aya, Professor at the Center for Integrated Science and Humanities, Fukushima Medical University. Finally, Professor Koriyama Chihaya, Professor at the Kagoshima University Graduate School of Medical and Dental Science. The information of the speakers is posted on the Science Council of Japan homepage. First, I'd like to welcome Professor KAJITA Takaaki for the opening speech. Please go ahead.
Okay, thank you. Distinguished guests, ladies and gentlemen, on behalf of the Science Council of Japan, I'm honored to welcome you all to the International Conference on Science and Technology for Sustainability 2022. Our conference theme is Disaster and Health, with the sub-themes Preparedness of Public Health, Health Resources, and Strengthening Governance, and Disaster Risk Reduction and Social Welfare to build a society where no one is left behind. the situation is exceedingly grave. In 2021, there were 432 disasters related to natural hazards worldwide, and an estimated $252 billion of economic loss was reported. As in the case of Pakistan last year, where 1/3 of the country was submerged in water, the danger has become increasingly devastating. As the G-Science Academies meetings of the G7 nations have been repeatedly stressing, climate change is a real and present danger. Many scientists around the world, including scientists associated with the Science Council of Japan, are engaged in research aiming to mitigate disaster risks toward the building of a sustainable society. To this end, scientists are undertaking proactive discussions in various forums. For example, the Science Council of Japan has been taking action in numerous ways to achieve disaster risk reduction and mitigation through international cooperation, such as the publication in 2020 of an academic recommendation toward a sustainable global society by strengthening disaster resilience. The Sendai Framework for Disaster Risk Reduction was adopted in 2015 as the International Action Guidelines for Disaster Risk Reduction and Mitigation. This year marks the midpoint for implementation of both the Sendai Framework and the 2030 Agenda for Sustainable Development. In order to achieve sustainable development, it is necessary to minimize the effects of disaster and increase disaster resilience, which is the power to overcome the damage and revive. It is very timely that this symposium will conduct its discussions from the perspective of social welfare and social work in order to realize a society in which no one is left behind. These discussions will address, based on the world disaster experience, the mechanism how the society creates vulnerabilities and also how it can solve or reduce them. People have high hopes and expectations for science to understand the two challenges that face global society, to present data-driven proposals based on solid research, and support the implementation of policies that may realize such society. Responding to such expectations is exactly what this conference is designed to do. To this end, let me express my earnest hope that there will be fruitful discussion at this conference. Well, thank you very much for your kind attention.
Thank you very much, Professor KAJITA. Next, Mr. GOTO Shigeyuki, the Minister of State for Economic and Fiscal Policy, will give us a video message.
Dear speakers and organizer, distinguished guests, it is a great honor for me to offer greetings as Japan's Minister of State in charge of the Science Council of Japan on the occasion of the opening of the International Conference on Science and Technology for Sustainability. This international conference has been held almost every year since 2003 by the Science Council of Japan, inviting distinguished academic experts from Japan and abroad to explore solutions to the global challenges that confront us today. The world is indeed facing unprecedented challenges, such as the infectious disease crisis that has now continued for 3 years, the energy and food crisis, and the climate crisis caused by global warming. Under such grave circumstances, I believe that today's symposium is a most timely occasion to discuss from an academic point of view the recent occurrence of large-scale natural disasters and the ensuing medical care and welfare which disasters necessitates. Science, technology, and innovation have the power to solve various social issues. I'm charged with overseeing the government initiative's new form of capitalism. The Cabinet adopted the Grand Design and Action Plan for a New Form of Capitalism in June last year, in which science, technology, and innovation are prioritized as one of the 4 pillars of investment, along with people, startups, and green transformation, digital transformation. Disaster response is one of the 4 major policies promoted by Prime Minister Kishida's administration. The government has been working steadily since 2021 on the 5-year acceleration plan for disaster risk reduction, disaster mitigation, and building national resilience, with supportive funding in the scale of 15 trillion yen. Further to that, the government will utilize new technologies, including digitalization, and strengthen public-private sector partnerships to deal with the increasing severity and frequency of disasters. With these efforts, we aim to build a robust and disaster-resilient nation. I understand that this also necessitates the input of knowledge from the humanities and social sciences, in addition to advanced information and communication technology, so that we can demonstrate more comprehensive disaster risk reduction capabilities. Internationally, the year 2023 marks the midterm review period of the implementation of the Sendai Framework, endorsed by the United Nations General Assembly in 2015. The United Nations Office for Disaster Risk Reduction is leading the progress review of its global implementation. It is most gratifying that many experts of relevant academic disciplines and field of activities are participating in this conference from Japan and abroad. I earnestly hope this gathering will bring together the consummate wisdom of academia and discuss the pressing issues from a wide range of perspectives. Together with individual knowledge and expertise, I hope also that these deliberations will bear fruitful results toward solving the global issues of our time. Thank you for your attention.
Thank you, Mr. Goto, the Minister of State for Economic and Fiscal Policy. So now I'm going to give a brief introduction of this year's conference. Okay. So the main theme of this conference is disaster and health. So this slide shows you the background and aim of this conference. The frequency of large-scale natural disasters has been increasing sharply in recent years. According to the 2020 United Nations report, more than 7,300 large-scale natural disasters occurs worldwide for the last 2 decades, from 2000 to 2019. During this time, 4.2 billion people were affected, and the death toll reached more than 1 million. From 2020 to the present, we have faced the unprecedented challenge of the global pandemic, so-called COVID-19. The aim of this conference is to provide academic overviews of recent and large-scale disasters, in addition to our experience we had so far, with which we can discuss how to secure the medical care and welfare in the coming future disasters. The conference is taking place over 2 days. The day one, today, will focus on public health, while today, tomorrow, will focus on the social welfare in disasters. So before going to the talk sessions, I will ask Professor Koriyama to make a brief introduction of today's theme. Please.
Okay, thank you very much, Professor Takeda. Good morning and good afternoon, everyone. I'm Chihaya Koriyama from Kagoshima University. I'm specialized in public health and epidemiology. And I am also a member of subcommittee for national program proposal to prevent and control large-scale infectious disease, Science Council of Japan. So today's sub-theme is preparedness of public health resources and strengthening governance. I would like to explain some backgrounds and the concept of this theme. Next, please. Yes. In 2015, the Sendai Framework for Disaster Reduction emphasized a shift from disaster management to disaster risk reduction. This keyword is mentioned in 7 targets to achieve by 2030. Disaster risk is expressed as the likelihood of loss of life, injury or destruction, and damage from a disaster in a given period of time. On the other hand, disaster risk is widely recognized as a consequence of the interaction among hazard, exposure, and vulnerability. Hazard is one of the factors that cause disasters, but should be considered together with exposure. For example, if an earthquake occurs where people and society are not affected, we need not fear. What matters is whether our lives and livelihood are exposed to the hazard. Furthermore, the vulnerability of the population or community is also a factor in the magnitude of the disaster risk. To further understand disaster risk, we need to consider not only these dimensions, but also the coping capacity of societies and people to prevent themselves from disasters. This diagram presents a whole picture of risk and related dimensions with 2 categories of coping capacity, institutional and infrastructure. Coping capacity also includes the ability of communities, societies, and systems to resist, accommodate, and recover from disasters, whilst at the same time improve human well-being. In this symposium, we will consider the governance of people, goods, and information based on past experience of various disasters to cope with any future large-scale natural disasters and to maintain the sustainability of our society. Please enjoy the speeches by 3 distinguished specialists.
Thank you, Professor Koriyama. Okay, so now let's move on to the keynote speech. The speaker is Professor Shaw Rajiv. Professor Shaw is going to talk about the health risk reduction and its implication in the global risk landscape. So, Professor Shaw, you have the floor. Please go ahead.
Thank you very much, President KAJITA, Minister GOTO, Professor Takeda, Professor Koriyama, my fellow panelists, and ladies and gentlemen. Thank you very much. I congratulate Science Council of Japan for bringing this very, very timely topic. And let me share with my slide. I hope it is visible now. So I hope it is visible.
Yes.
Yeah,
Okay.
Okay. Yep. So what I will be talking about is health risk reduction and its implication to the global risk landscape. And a little bit of my introduction that, yes, I am in Keio University, but I also work on the science policy interface as my role in the United Nations Science Technology Advisory Group as its chair, also in the IPCC. I also do some work on the startup and innovation and also the board chair of NGO and NPO. Why I am talking about this one is that it's not only just the science and technology which possibly can make a breakthrough. We need different types of stakeholders. And my main intention of putting my feet on different positions is try to learn from those stakeholders and try to see that which type of science and technologies are required. I will talk about 5 specific contexts. First is this global risk landscape. This is the global risk outlook. Every year it is published. I will be giving you example of 20, 21, 22, and 23, 4 years. 20, it talks about different types of global risk, the different boxes and color coding. What I would like to just draw your attention is these green boxes, which are the environmental risk. This particular risk outlook started by World Economic Forum. So their main interest was the economic risk. But when you actually look at the global risk, that the environmental risk, whether it is climate change, disasters, biodiversity losses, that becomes quite high in terms of likelihood as well as impact. 21, the same report. I must say that this type of reports comes usually in January. So 21 reports is the analysis of the previous year. Here, of course, 21, you can imagine that we had already the COVID in 2020. So infectious disease becomes one of the top in terms of impact. But still, the other issues like extreme weather, climate change, human environmental changes, and so on, it remains. But in 2021, there were new risks which came, and this is very, very important, which is the digital power concentration or digital inequality. Many of us, we understand that in 2020, we changed our working style, we changed our educational mode, we went to more on the digital. We are the fortunate one possibly having this type of Zoom connectivity, but not the whole world has the same type of connectivity, whether it is developing country, whether it is urban, rural area, whether it is the age group, whether it is the gender gap. There are many different types of gaps which actually produce this type of digital divide. Last year, 2022 report talks about, again, the cybersecurity, adverse technological advances as major challenges. But still, again, this green one, climate action, extreme weather, biodiversity becomes top 3. This year report, which just got published last week, there also it becomes a major challenge. One is the energy needs. And then also, if you see the interconnected of the different types of risk, all the different types of risks are getting interconnected. Here, I was very surprised, not surprised, but rather it was quite new that this cost of living becomes the top risk, which was this year, like last year's analysis, and a major implication goes to the current war which is happening between Russia and Ukraine. It has a big implication on the food prices, it has a big implication on the energies or the gasoline, and obviously the cost of living. So what my point here is that when you talk about a health risk or disaster risk or climate risk, these are not isolated anymore. These are all interconnected. So any strategy we put forward needs to look at this global risk landscape and which is also evolving over time. So my context one is that the risk landscape is dynamic and changing. These are interconnected. Digital divide, inequality, cybersecurity, inclusive growth becomes very, very important issue, and we need to think about in future. We heard our moderator, Professor Koriyama, mentioned about the Sendai framework. And Sendai framework gave a very strong link or established a very strong link between health and the natural hazard. I was counting actually that how many times the word health was used in Sendai framework. It was used 76 times within 37-page document. And it was used not only for the global issues, but also very importantly, the primary, secondary, tertiary healthcare, especially at the local level. The capacities of the health worker, understanding of the risk reduction, applying different types of risk reduction approaches in the health work, this became very, very important issues. So in this particular framework, we talked about cascading risk, we talked about complex emergencies, we talked about new stakeholders, science, technology, community, private sector as the more emerging stakeholders. It just happened that we published a book on public health and disasters back in 2020. And this book was published in 2020, January. And then this whole 2020, we were talking about COVID-19 and so on. But for your understanding, many of you possibly already know that WHO has this health EDRM, which is the Health Emergency Risk Management Framework. They published it in 2019. Then UNDRR and WHO, they brought this health addendum to the city resilience scorecard, which is how you bring the health issue incorporated into the resilience framework in the local level, in the city level. And then our book actually also talked about quite a bit on this health emergency and disaster risk management. Our main understanding was that it is not just, again, health issue per se. We need to think about the implication of the financing issues, data management, supply chain management, different types of transport planning, resource mobilizations, and so on. And possibly we have seen, experienced, and did certain work on each of these 6 things, which I have mentioned here in the slide, during past 3 years of COVID-19. So context 2 is that, yes, we have global framework, HEDRM as one of the major health and emergency, which actually brings these 2 sectors together, and it needs an interdisciplinary approach. Couple of our work during COVID-19, we developed this very simple tool, which is called the risk assessment tool for COVID-19. And there it was quite early stage, and we also wrote some paper on this one. And we try to understand that, of course, it's a very complex factors of health, behavior, exposure, social policy. Health, possibly you can have something from the government side, but when we talk about the behavioral approach, like very simple thing about use of mask, of your hand washing, sanitization, social distancing, and something, all this type of thing, I think this becomes a very, very cultural issue. Then, of course, which type of places you live, whether you live in the isolated house or whether you live in an apartment building, that actually gives you a different types of exposure. And of course, the social policy, some of the countries have very stringent measures of the lockdown. Some of the countries, including Japan, had possibly no lockdown, but it is more the community compliance, more voluntary compliance, which actually helped. So we need to think about this community and governance interface for risk assessment. Risk governance is another very important issue where we really need the science-based decision-making. This is again an example from Japan, like how the very strong science-based decision-making has helped Japan, which has a very high exposure, being so close to China, so many direct flight from Wuhan at the initial stage, very high population density in the urban cluster, very high aged population. But still, I think if you think about the global impacts, I think Japan has been at least successful to make this peak little bit shifted so that you make more, prepare your health infrastructure a little bit better. And for that, there are many different factors which help, starting from response, government response, cultural issue, the basic healthcare system of the country, sanitation, food habit, immune. And we had a very specific paper for that. Adaptive governance is another issue. Like we also experienced that in 2020, when we had COVID, when we did not have the vaccine, we had severe flood in Kyushu and in the southern part of Japan. And there were many different lessons we learned, whether it is the shelter management, whether it is the critical health monitoring, how you make, like usually in the shelter, people used to be very close, but then if you make a proper distancing, then only 40% you can have the occupancy. So whether you have enough shelters or not. So there are many different types of issues, and these were not written in any of the disaster risk management plan or manual. These are all the adaptive governance, which possibly different types of local governments, they have been working with the help of different other stakeholders. Volunteer management, like as we know that after disaster, there are so many volunteers who come there. But that time there were no vaccines, so the many prefecture government, they did not allow the other volunteers from outside the prefecture to come in. So there were, we did some work in Kumamoto areas, and we saw that even after 3 months, 4 months, there were lots of garbages or the debris which were there. So there are many different types of issues which came in. So context 3 is that, yes, we need risk assessment, we need a very strong science-based decision making, but this whole concept of adaptive governance is possibly one of the key to bring this health sector and the disaster sectors together under this world of uncertainty. I would like to also emphasize something here on this digital issue. These are some of the statistics which like last year we had around 5.03 billion internet users globally. And of course, Asia, with this largest number of population, has the largest chunk of the internet user. Almost 60% of the global internet users are from Asia. But if you see this growth over a period of almost 10 years, lower one is the rural area, upper one is the urban area. These are increasing. But if you see this gap of the urban-rural divide of internet and digital connectivity, that gap, what was there in 2012, which was maybe around 30% or so, this still remains around 20-25% in 2020. So that urban-rural divide becomes a major challenge. And there, my context 4 is that how we can make an inclusive digital growth for making a better disasters risk management, better healthcare risk management, and possibly bringing this together. My last point is here, again, for our Japanese colleagues here, many of you all understand it, that this digital denentoshi, which has been the new concept of Kishida cabinet from last year, that to promote regional revitalization through digitalization. I think that's a very, very important thing, because digital drive cannot be only concentrated in the urban area. Digital drive cannot be only concentrated within the youth community. They are digital native. But our challenge is how we bring these digital issues for the well-being, for different types of innovation, so that it is linked to the sustainability. So it's a very, very important that, again, we have a better inclusive approach of this digital drive. And there, this digital denentoshi concept is very important. We recently did a couple of books on this issue. One is the Society 5.0 Digital Transformation and Disasters, and another one is this Emerging Technologies and Disaster Resilience. And there we try to argue that how this health, well-being, disaster risk reduction, and this whole concept of digital transformation, or what we call the Society 5.0 in Japan, maybe Industry 4.0 in other countries, how it can actually bring together and to achieve an inclusive society where we focus more on the human security and well-being. So my last point here is to do that. possibly only science and technology will not be able to do. We need lots of other sectors, but I particularly want to highlight here that the private sector, or what I call the science-based entrepreneurship, is very, very required. We need to possibly engage the youth population. And so youth and the young professionals, how we can actually provide an entrepreneur ecosystem so that government, academia, and enterprise, they come together and try to make new innovations to break all the barriers. So final context is, yes, the sustainability, well-being, and innovation is a very important thing. Digital drive and emerging technologies are important, and the entrepreneurship and youth involvement is of utmost important. I don't give any conclusion, but I just leave a few key words which actually came in this small intervention, and I'll be very happy to get back to some of them during the Q&A sessions. Thank you very much, and thank you for your kind patience listening.
Thank you very much, Professor Shaw. Okay, so we don't have a question time for each talks, but instead we're going to have a general discussion afterwards. Okay, thank you very much anyway. Okay, so let's move on to the next sessions. We're going to have two speakers. The first speaker is Professor Kuni Osamu. Professor Kuni is going to talk about the coordination and collaboration of health risk prevention, preparedness, and response, PPR. Professor Kuni, please.
Yes, good morning or good afternoon, everyone. I'm currently in Bangkok, Thailand, so it's very, very hot. So I really want to blow the hot air to those who are living in a very extremely cold weather. So I'd like to share my slide. Can you see my slide?
Yeah, I can see.
Okay, great.
Perfect. Yeah.
Okay, great. Thank you. So let's get started. So the statistics show that the frequency and the severity of natural disasters, as you said, that especially so-called climate disaster has been increasing in the past decades. And I witnessed it in many countries. For example, floods in Bangladesh with 2/3 of the land areas inundated in 1998. I lived in Myanmar for 3 years in UNICEF, so I also I was affected actually by myself, but also I joined the relief work in this Cyclone Nargis, killing around 150,000 people in 2008. I also joined that relief work and also a survey in Indian Ocean earthquake and tsunami killed over 220,000 people in 14 countries, although it is not regarded as a climate disasters. So I've been engaged in emergency relief and rapid assessment soon after such disasters happened. So this is an example of a lack of coordination and collaboration among donors and the implementing partners who provided emergency relief and early recovery assistance to people affected by Indian Ocean tsunami. I witnessed so many duplications of relief activities in evacuation centers, especially close to Colombo, capital of Sri Lanka. Seeing patients with lots of medicines provided by multiple medical doctors and teams from many countries. But very limited assistance was given to the affected people living far from Colombo. And there was a huge discrepancy of assistance and response due to lack of coordination and collaboration in this emergency response. So what are issues when you don't have good coordination and collaboration in emergency response? First, as I said, it causes duplications and gaps, leading inequitable access and delivery of essential services to the affected. Second, it caused inefficient use of limited resources, which are not only relief supplies such as food and medicines, but also human resources and logistics locally available, such as relief workers, trucks, and warehouses. Third, relief work without coordination often give burden on those affected as well. For example, people in evacuation centers were asked many times what happened, what they need, or what the situation is, but many relief organizations and workers. It bothered and annoyed the affected people. Such surveys or assessments should be done in a coordinated way without doing harm to the people. In many cases, I also found lack of understandings and actions about coordination in the past. For the purpose of coordination, they had a series of meetings and shared information among relief organizations and related groups. But it is not coordination and spontaneously not leading to efficiency and effectiveness in response. Coordination needs a strategy, tactics, and concrete actions to minimize inefficiency and maximize impact. We need to know for what and when to require coordination. For what we need coordination? Mainly data, supply provision, human resources, and funding. When? In the stage of assessment, planning, interventions, monitoring, and evaluation. Actually, from the beginning to the end of disaster response, recovery, and reconstruction, we need coordination. Then next question is how to coordinate. This is not easy, quite easy to tell, but not easy to do. So based on the past experience and lessons learned, we need to prepare mechanisms, tool, model, module, and manuals at global, regional, and country levels. And we need to require coordinator and set their mandate, role, and skill sets. The world community and relevant organizations need to support and facilitate coordination to function in emergency. So this is an example of these coordination mechanisms in the world, especially coordinated by OCHA, the United Nations Office for the Coordination of Humanitarian Affairs. Actually, I also joined the crafting this approach and also implementing this as a UNICEF. And usually at global level, we set interagency standing committee, including UNICEF, OCHA, WHO, and etc., and determine who is leading and what kind of cluster. And country level, usually humanitarian coordinator, usually the head of UNDP, he's kind of coordinating at the time of emergency and set up the interagency standing committee, IASC, and also ask each lead agencies to coordinate in each cluster. So they have identified 11 clusters such as health cluster, nutrition cluster, water sanitation and hygiene, food security, and determine the lead agency to coordinate. For example, WHO is health cluster lead and UNICEF is a cluster lead of nutrition, water sanitation, and camp coordination. It's really depend on the situation in a country. If there is no good capacity in a certain UN agency, other UN agency could support. And even not UN agency, like IFRC, International Federation of Red Cross and Red Crescent, could be leading some of the, for example, camp administration or the management. This is an example I joined and supported at the time of the Cyclone Nargis in 2008. We made a Myanmar government, ASEAN, and the UN organizations tripartite meeting and set the planning of joint assessment. And we conducted the periodic review of this monitoring and evaluation. So we jointly planned an assessment and periodic review by dividing small units of affected area for survey and analysis. And this is an example visualization result of a survey on access to medical services. So you can see gaps and the locations in need of medical services from this joint assessment. We also coordinated for funding, gathering, and donation through consolidated appeal process. So after this kind of assessment, we made a plan in each cluster and set demand of funding in each the cluster. So like food, they set the kind of target to cover, whole affected people, and targeted $120 million for this assistance. But at this time, we show this kind of graph very periodically to donors so that the donors can see that where the gap of funding. Such coordination is required not only in low and middle income countries, but even in high income countries like Japan. This is a photo at the bottom showing the coordination meeting I led in an evacuation center of Nishinomiya Gymnasium soon after the Hanshin Awaji earthquake occurred in 1995. I found so much duplication, so many people gathering, coming to this Nishinomiya, but so many, medical teams, for example, visited, some evacuation center very close to station, and the patients are seen by many medical doctors and got sometimes antibiotics, multiple antibiotics. This. So, and this is a kind of a situation of Hanshin Awaji earthquake. And people affected are lying on the floor of the gymnasium. But you can see the same situation, almost same situation at the time of Great East Japan earthquake and tsunami in 2011. So after Hanshin Awaji earthquake, the coordination among medical relief teams were quite well organized, and the government set kind of a training course of coordinators of medical teams. But in this Great East Japan earthquake, I found that still duplication and gaps in a variety of relief services, especially to support shelf, food, water, sanitation, protection, children, women, and others. So quality of response was not so good, and there was no good standard. So I kind of made a decision to write a textbook called Public Health in Emergency in 2012, asking over 30 experts of disaster relief, humanitarian assistance, public health experts, and made it. But after 10 years, actually during that time, we had other natural disasters like Kumamoto earthquake and the flooding, etc. At the time, I found that I've heard from many relief workers, still the similar type of situation occurring on the ground. So we revised this textbook last year. We published, inviting the 70 experts, using the challenges and good practices and how to, improve by concrete action. Okay, and actually last 9 years, I was in Geneva working in Global Fund to fight against HIV, TB, malaria. So during the COVID, I was kind of engaged in the fight against COVID. And especially Global Fund was one of the 9 international organizations, key organizations to respond to the COVID, especially the access to COVID-19 tools, ACTA. Especially, we made 3 pillars: vaccine, therapeutics, diagnostics. So we try to expedite the research and development and access delivery of these 3 pillars. As you know, COVAX is one of these pillars in vaccine, and Global Fund, we are responsible for diagnostics, therapeutics, and health connectors. So this is last slide. We need to be prepared for the worst case scenario. We always need to be preparedness. But at the time, we have to set the scenario of a worst case based on that hazard and the risks assessment. And we need to clarify who does what, when, where, and how for better coordination, at which level. We need also concrete the planning. And at the time, of course, strategy is important, but it is not enough. We need real operational plans and also training and the repeated simulations. Otherwise, it is quite difficult to realize that kind of action plans in the real emergency situation. Thank you very much.
Thank you very much, Professor Kuni, for great talk. Okay, so let's go to the next speakers. I'd like to invite Professor Goto Aya. Professor Goto is going to talk about health literacy as a driving force of community resilience in crisis. Please.
Thank you, Professor Takeda, for introducing me. Let me share my slides. Okay, it is my great honor today to talk here to everyone about my activities around health literacy that evolved after the Fukushima nuclear disaster, which Dr. Kuni mentioned with pictures just now. Today in Fukushima, we have lots of snow, unlike where Dr. Kuni is. And the photo in the back is taken just this morning. Okay. Let's review the concept note. In the concept note for today's event for this session, information is listed with people and goods as essential items to prepare for disaster. And I think my role here today is to talk about my experiences on delivering the information when a crisis occurs. And my talk will be mostly at the community level. Dr. Sho, in his talk, I noted 3 important keywords that were adaptive governance, youth capacity building, and tackling digital inequality. And I learned from Dr. Kuni that coordination is not just having meetings, it means taking actions. And I will touch on all of these at the community level in my talk. I will begin with how I started the work on health literacy and its concept, then introduce our capacity building activities for professionals and children. And furthermore, I will explain how our expertise developed after the Fukushima nuclear disaster helped us work for children when facing a new crisis, which means COVID-19. In Japan, public health doctors like myself work with public health nurses to diagnose the community using data, including health statistics. And as treatment, we prescribe health policy and community activities. And I would say health information is one of the medications we prescribe. And this is where I started. Right after the 2011 Fukushima nuclear disaster, I analyzed child health checkup data with public health nurses. So we did the community diagnosis. And interestingly, we found that mothers who were concerned with the differences in risk perception about radiation among family members were more depressed. And then around the same time, I started organizing meetings with the public health nurses, and I analyzed also their discussion notes. And I found that they recognized their roles as an information channel in the community they live and needed communication skills development. So mothers were confused about the health information provided and nurses needed communication skills development. And here I came to learn the concept health literacy. It is defined as people's ability to understand and use health information to improve health. And recently, this definition has expanded to include our health professional skills to improve people's access to health information. So this means if we improve our skills, we can lessen the burden put on people to try to understand us. And this is clearly explained in the US Healthy People 2030 as the organizational health literacy. Health professionals as a team should equitably enable people to use health information. And there is another new concept that is e-health literacy. It's people's ability to use digital information. And we have found in our research that people's e-health literacy level is actually associated with their actual usage of digital tools. And this tells that we should support those with low e-health literacy level to better use digital information so we leave no one behind. Well, let's get back to the two arcs of health literacy. First of all, I started a project to increase health professionals' skills. I adapted the US health literacy training model to the Japanese language and context. There are three components in the training. And firstly, we teach how to assess the understandability of health information. And secondly, we teach how to improve the information, followed by field practice of the learned skills. The whole workshop takes about 2 to 3 hours only. And we teach skills to improve sentences, graphics, and also we teach ways to understand the intended audience information and health literacy needs. And on the right-hand side is a little booklet that I developed and use in my health literacy workshop. And by the year 2019, about 25% of the public health nurses in Fukushima had attended the workshop. Over half of the attendants used learned skills in practice at the 1-month follow-up. They had more positive attitude toward feedback from the community residents, and their self-evaluation of risk communication competencies improved. Moreover, this is important, an assessment among the intended audience showed that older people and those without regular doctor visit were more likely to notice the improvements in health information provided by the trained nurses. So the health literacy capacity building would contribute to promoting communication, bilateral communication between professionals and the public, and also preventing inequity in access to health information. And I keep getting requests to run the workshop for different groups, and professionals include the nutritionists, school administrators, and disaster prevention officers. And at universities, I teach medical and nursing students. And recently, Dr. Koriyama, who is the chair of this session, invited me to give workshops for international students and JICA trainees from the Pacific Islands. So this health literacy training workshop is crossing borders. And here is a case after the COVID-19 pandemic. A prefectural office outside Fukushima invited me to give a workshop about a year ago, and participants were mostly nurses and administrators. And over 80% answered that learned skills could be applied immediately at work. And one participant wrote that learned skills could be applied in supporting COVID-19 patients. I will share the skills with my colleagues. Another one wrote about being reassured of the importance of residents' points of view. So these indicate that learning health literacy empowers crisis responders and improves their teamwork and resident-centered care. And secondly, I would like to move on to the right, the second arc of health literacy. I moved on to plan and implement a project to increase community residents' skills. WHO states the importance of health literacy lies in empowerment of people. So health literacy is more than just making easy to understand information. Here's a recent paper explaining very simply the 3 points of communicating with the public. The third point is that a participatory approach is important in crisis communication. And in my current work, I work with children. This school health project called Creative Health has 3 components. First, we developed the ACT workshop in the middle, which applied the performance-based method adopted from the UK in order to withdraw children's opinions through making and acting short dramas about the place they live. It is lots of fun. We then added the topic-based body and food workshops. Our activities aim to facilitate students' scientific and creative thinking, working in teams, presenting and expressing their opinions. And after attending, students perceived their health and foods in their community more positively after participating. And we plan to expand the Creative Health Project to Indonesia, Cambodia, and Rwanda, but then the pandemic started. So what we did was the picture shows our online training of the ACT workshop for Indonesian facilitators. The workshop was immediately implemented at the Indonesian schools in collaboration with Dr. Koriyama, and students enjoyed and parents were happy about children's learning. And importantly, teachers learned to accept students' opinions and recognize their abilities. So what we did in Japan when facing a pandemic is here. Based on our existing network with local school teachers through the Creative Health Project, we developed written materials for children. These were for infection prevention and self-learning materials to do little adventures at home about science and mathematics. And these were distributed to children and families as handouts and through school web pages. And our experience was compared with a similar case in Madagascar. And we identified 3 common communication strategies. These strategies were to develop culturally tailored and visually appealing materials, disseminate through existing channels in a timely manner. And in addition, our experiences emphasize on the importance of collaborative effort based on existing trust relationship. And this is my last slide. So in summary, the evolution of our health literacy initiatives covers 2 arcs of health literacy. It's crossing borders and prepare us to face a new crisis through existing trust relationship and by utilizing digital tools. Thank you very much for listening, and I look forward to discussing with you all. Thank you.
Thank you very much, Professor Goto. So now we have 3 excellent talks from all speakers. I would like to thank you again for all speakers for very informative presentations.